If you're in Nigeria, happy Independence Day because it's our Independence Day here in Nigeria. And today in Nigeria is 65 years old. We're quite old, right? So thank you for always tuning in for this webinar that comes up once in a week. And thank you for also taking time to check out all of our social media handles for our podcasts, our nutrition spoken words, and other activities that we normally engage in. And today we'll be talking about the heart. 2 days ago, 29th September to be precise, was World Heart Day, a day designated for celebration of heart because the heart health is a very important one. And here we today talking about a matter also related to heart. You and I know that the heart is very, very precious. That is why you hear people say, oh, my heart, I don't want anything to hurt me. It's just a precious organ. The heart is very precious. The heart is very delicate. Okay? So for today, our topic is heart health. Each bite counts. This simply means that each bite of food, drink, whatever you put in your mouth, whatever you ingest in your system, counts a lot. It can make your heart be happy with you, or it can make your heart to be angry with you. And when your heart is angry with you, you know the health implication is going to show up later as you get older. So as we look at this topic today, we'll be considering it under some segments. We'll talk about the heart. We'll talk about food you should eat for the heart. We'll talk about activities, both physical activities, lifestyle you should engage to have a healthy heart. And as I always tell people, nutritious food and healthy diet can never break your heart. These two things, nutritious food and good lifestyle can never break your heart. Because some people may be eating good food for their heart health, but at the same time, the kind of lifestyle that surrounds them make it difficult for them to have a healthy heart. For example, maybe someone that is smoking around you. You are not smoking, but you constantly stay in an environment where they smoke. It will also affect your heart. Because sometimes people will say, it will affect the lungs, so they just speak more of the lungs. But that smoke will also affect the heart. Sometimes it may not be smoke of cigarettes or other items, but it may be smoke or from the polluted air in the environment. This also affects the heart. So down to our topic, heart health. Every bite counts. So when you know that every bite of what you take counts for your heart health, you will be conscious of what you take. So let's start with the heart. How is the shape of the heart? The heart is a fist-sized organ that pumps blood throughout the body. It is a circulatory system main organ, okay? Muscles and tissues make up the heart, and it is called the powerhouse of the body. So when you look at the fist, your fist like this, that is the shape of your heart. That means the shape of your heart and the shape of another person's heart cannot be the same. The heart also have walls, 3 layers. We have the one we call the endocardium, that's the inner layer. We have the myocardium, the muscular and we also have the epicardium, that's the protective part of the heart. Now, where is the heart located? The heart sits behind the left of your sternum. The sternum is the breastbone, which is in the middle of your chest. That's why it's common. Someone will just say, my heart, oh, my heart, oh. It's by the left, it's not the right. Okay. So, heart health is important because it helps to guide individuals to stay healthy. It is also very, very good to have a regular checkup, even when there is no symptom, because some heart-related issue, some may not show you the signs immediately. Let's take a look at the low blood pressures. Blood pressure. I've met a couple of people that have low blood pressure, and they will tell you that they didn't know, they didn't feel the sign. Do you understand? That they didn't feel the sign that they have the low blood pressure. That is how tricky some heart issues may be. You may just feel the sign once. Let me say a particular heart issue that fatigue is part of it. You may just feel fatigue. You may, I stressed myself today. It could be because I stressed myself. You will know that the body is already giving you sign that, hey, something is wrong somewhere. Please go and do a proper checkup. Okay, now, being that the heart is also the powerhouse of the body, it's possible to do a heart transplant in severe cases, but the challenge is that heart donors are very, very scarce. Unlike someone going for kidney donor or all that, heart donors are very, very scarce. That is why you have to take your heart health very serious. Okay, and heart conditions can lead to common health issues like slumping and death in most cases, especially when care have not been taken to. When you've not taken care of, what is wrong with me? Could it be I'm having a heart issue? Should I do a general checkup? And it's common, like in this part of the world, we are from Africa. When someone feels somehow to the point they say, go check yourself. The common thing people go for is malaria and typhoid. That's the common test they just want to. But it's beyond that. At least twice in a year, you just do a thorough checkup. That's why they have the health insurance company and all that. You do a thorough checkup to check your body and make sure that everything is in order. Because a neglected health issue, a neglected sign can lead to adverse issue. Now, there are some common conditions that affect the heart. We have the high cholesterol, which everybody's used to. The high cholesterol, that's when your blood has so many fat in it. We have the high blood pressure, we have the low blood pressure, we have the myocardial infarction. That's the common one they call the heart attack, when it's suddenly maybe a coronary artery blocks the cut off of oxygen to the part of your heart muscle. Okay, so they also have the one they call angina pectoris. These are all cardiovascular diseases. Arrhythmia, or what? Yeah, arrhythmia. That's a heartbeat that is too fast or too slow, or beat with an irregular pattern. So this is what you as a person, you should observe yourself, understand your body. When the doctor say understand your body, is very, very important, because when they're asking you questions to know, okay, this could be this could be this, before the diagnosis sets in, you need to understand your body. Do you have palpitation, or you notice that your heartbeat is quite slow, or you notice that there's an irregular rhythm? These are the things that you need to check sometimes. Understand your body, okay? Then you have the CAD, that's the coronary artery disease, okay? That's plaque building up that leads to narrow arteries. Now, some of the symptoms of this heart issue now: shortness of breath, dizziness. Shortness of breath is hi, Chelly. Hi, thank you for joining. So, please, if you join, can you do well to maybe send a message where you're joining from? Okay, I'm Chine, I'm a nutritionist, I'm in Nigeria. So, Tato Ndamana, hello, can you just say hi, you're joining from here? Chelly Galino, can you say, okay, you're joining from this city? So at least I'll know where my audience are from. Please. Thank you very much. I'll be glad to see that. So, chest pain is also a common symptom. Swelling in the lower body is also a common symptom. Dizziness, heart palpitation. So sometimes when it comes to something like dizziness, fatigue, someone can say, I'm having dizziness, I'm having fatigue because I stressed myself. But that is not always the truth. Sometimes you actually need to look at your body. And there are also common heart tests that you can do. The x-ray is there. You can also check the most common one is cholesterol level. You can walk into the hospital and you check your cholesterol level, do the chest x-ray, you can do the chest x-ray, you can do the cardiogram rather, echocardiogram, you can do the EKG, you can even do your blood pressure. The blood pressure is so common that you can also have the machine of the blood pressure in your house. And there's one funny thing about heart health. Someone will tell you, I don't have blood pressure issue. Why should I have the machine in my house? These are things that are very common you should have in your heart. Hello, Chelly. Hello, Tato. Please, can you tell me where you're watching from? Thank you for joining. I'm so excited to see you on this call. Thank you. But this is something that should be part of the house. I remember as a growing child, my parents had first aid box at home. At first, we didn't understand. The kids in the house, we didn't understand because this first aid box, we can stay 6 months and a year. Nothing will happen to anybody in the house. So we felt it was a waste of time, a waste of money. At the end of the day, they will pour the medications there, they put another medication there. Then with time, I understood the essence of the first aid box being in every family. Especially when there was a time my sibling was bitten by a dog. So luckily for us, we had the Blackstone, there's and other medication for dog bite already in the first aid box. That was when I started seeing the importance of having first aid box in every house. Nerve and bone, mention it, all those ones that can help and handle sprain and all that. They were all in the first aid box. So if you have a first aid box, you can also put the one for blood pressure in the first aid box. So you can use it and monitor yourself, even if blood pressure is not genetic in your family line. The possibility that environmental factors can make you have it is also there. So you should also have it in your house and your first aid. Now, what are the lifestyle that can encourage a healthy life? One is to engage in physical activity. Even if you're someone that works at home, because now the idea of working at home, virtual assistant, and a lot, in years to come, is going to also cause a very big issue in the health of people. Okay, so if you're someone that works from home, please engage in physical activity. Take your time, walk around your estate, walk around your environment. Just take 10 minutes, 20 minutes walk and come back. You're helping your heart. Don't sit one place for the walk. Everything is not enter car, jump bike, enter taxi. Sometimes just walk. If you need to get to this place by 8, you can just do a 30-minute trek or 20 minutes for a healthy heart. Then you have to reduce stress. Why I love to talk about stress is that sometimes people take stress as part of exercise. No. They'll tell you, do you know I do this, do that, only me in a day. So it should be recorded as exercise for me. No, it can't be recorded as exercise. Exercise and stress are two different things. You have to find a way to reduce stress for your heart. And finding a way to reduce stress, one good thing you do for yourself is to take adaptogenic foods. Adaptogenic foods are foods that are designed to help in management of stress. So when you take adaptogenic food, you are helping the body to manage stress, and it will have less impact in your heart health. Then another thing, you have to quit smoking or staying around people that smoke. Even if they tell you, do you mind just one stick or two sticks, taking it in front of you, please quietly leave that area. Don't say, this is my very good friend, or let me just stay since I'm not the one smoking, but you are also taking part of it. And you don't even know how strong your immune system is. Another thing is to get quality sleep. Quality sleep is very good. Quality sleep. I feel one of the reasons why people do not get quality sleep is because their to-do list is being put in a way, in a manner that is very, very difficult for them to achieve what they set out to do in a day. But if you have a well-planned day, weeks, months, and everything, you can get quality sleep. And another reason why some people do not get quality sleep is if you're someone that procrastinates a lot and now you're trying to meet the deadline, you want to do everything at once, it is very, very impossible for you to get that. Okay, now get regular screening tests. The cholesterol level is something easy that you can just start from. Cholesterol level, start from checking your blood pressure, start from walking around. And in the exercise part, as lifestyle for a healthy heart, in the exercise part, there's something you need to also look at. If you are somebody that is not used to exercise for a very long time, when you want to start with just strolling down the road, then from there brisk walking, from there little jogging. Please, that is the way to start this pattern. Don't start on the first day by jogging very, very far or running very far. If you have not exercised yourself for a very long time, when you want to start with just walking. Before brisk walking, that's walking fast. Then the third part of it is when you now start doing little jogging before you start running fast. Because if you start with running fast, since it's something that you've not engaged in for a very long time, it can also affect your health. Then another thing is you stop smoking and avoid secondhand smoking. Eating healthy diet can never be underrated, but at the same time, portion control should be at check, because someone will say, oh, you advise we should eat this, we should eat that. That's good, but portion control is also important. That's why if you go to the pharmacy, they give you medication, they will tell you this one, take one in the morning, take one at night, because in the medical world and in the food world, without portion control, you can either enjoy yourself or you get the results you want. Okay, so The next thing now we look at unhealthy food to avoid. What are the unhealthy food you can avoid to stay healthy for your heart? High sodium food, high sugary food, sweetened beverages, high refined carbohydrates, alcohol, highly processed foods such as meat, red meat, the sausage. Have to also avoid it. You also again saturated food, fat and full full fat dairy products. You also have to avoid it, especially if you're someone that have already developed a heart issue. Okay, if you're someone that have not developed it, you still have to avoid it. But if someone that you're already having this heart issue, most of these unhealthy food, you just need to eliminate all of them. Trans fats can come, that found in some of the fried fast food, chips and baked products. Then what are the foods for the heart? What are the foods you eat and your heart will be very, very happy with you? Number one, when it comes to seeds and nuts, flaxseed. Flaxseed is very, very good. Flaxseed. Chia seed is very good. They are very rich in omega-3 fatty acids, which are good nutrients for the heart. Like, based on practicing what you preach. I'm not in my house right now. If I was in my house doing this, I would have shown you my flaxseed. My food collection is just very funny. My flaxseed, I have my flaxseed, I have my chia seed, I have my acha, I have my finger millet. These are part of the things I take. Uh-huh. Then fat-free dairy foods or even low fat for people that are already having the issue of heart issue. Then healthy fat like the olive oil, the avocado oil, lean meat and fish. Then the diet. Dash diet is simply dietary approach to stop hypertension. That is the meaning of dash diet. Then legumes are also wonderful for the heart. So what are we saying in all this? A healthy heart is a key to a healthy life. Okay, and it's very important we engage in a lifestyle that can make us have a healthy life. Regular checkup, because most heart issue may not really give you sign, but regular checkup can help you prevent some of this heart issue. And when it comes to the matter of the heart, nobody can take care of your heart more than you. Forget I give you my heart. I don't have heart again because I've given you my heart. Mm-mm. You are the person that can properly take care of your heart more than any other person. So it's important you give your heart the right food to take care of it than waiting till you come to a particular age. This is something I've seen is very common, especially as a nutrition consultant is very, very common. You will meet somebody, the person will tell you that they have to wait till they get old before they start taking care of their heart. It doesn't work that way. The earlier you start taking care of your heart, the better for you. If you wait till you're old, if you wait till you get a particular point, it's just like the issue of prostate. Someone will say, prostate issues for people that are 40 plus. Then you now engage in some unhealthy lifestyle, wait until you're 40 plus to start taking care of it. That won't be a nice one, because you don't even know if it's genetic or if you have acquired it due to some environmental factors around you. So it's very, very important we should note that you are the only person that can take care of your heart the way you want to live healthy. Once again, thank you so much for being part of today's webinar. My name is Chine Duru. I am a nutritionist representing Duchu Foods and Nutrition Limited from Nigeria, and I'm glad to have the section again with you. And Believe me, I would love to get feedback from you. I want you to practice, share with your loved ones, and then I would love to hear the results. Do enjoy the rest of your day. Bye.